Is brain fog a health condition? What works to get rid of it?
So brain fog is a very loose term, and is it real? Yes, but to which person and which history are we getting from the patient that they're having brain fog? So, for example, if they're an elderly patient or if they're a young patient, we have to assess what brain fog means. Sometimes could it be post chemo brain fog? Chemo brain. Can it be due to thyroid? Can it be due to blood pressure? Can it be due to longstanding diabetes or other inflammatory conditions? Could it be due to adrenal dysfunction? So, brain fog is a loose term. Western medicine doesn't have a true diagnosis for it because they can't biopsy it, number one, and there's not a blood test for it. But we have all experienced brain fog on some level, right? The days of your memory is just not very clear, foggy. So that's kind of a nice idea, right? The fog is there. When it clears up, you have some days are very clear, some days it's very, very foggy. So we have to look at what is the definition of brain fog. Now, for each person, though, it could be just fine-tuning thyroid and their memory function gets better. Sometimes it's fine-tuning and making sure the blood pressure is okay, or making sure the blood sugar is good, or making sure their sleep is well, or making sure their adrenal function is better, or making sure for everybody all across the board is making sure they have anti-inflammatory on board, keeping that inflammation, because the more inflammation in the brain, the more brain fog you have, right? Regardless of where it's coming from. So it could be food allergies, could be some environmental toxins, could be stress. Usually it's a combination of all these things, but it's keeping that inflammation down. Now, there is certain things that we give. Again, bosmeric being an anti-inflammatory helps lower the brain inflammation. But there's also other aspects that we give, like we have formulas like Be Mindful and Neural Formula Forte, and even Percepta Professional. These are things that we actually can show that will improve your neurological function. Amyloban, these are certain parts of mushroom extracts that actually will stimulate your brain-derived nerve growth factor. So we have to be careful of just giving something. We have to look at, well, why does this person need this, and then target that. So some people actually have traumatic brain injury. Some people have, they served in the military. Some people are boxers and can have brain fog from a different perspective, right? I'm a football player, a different perspective, traumatic brain injury, CTE issues. So their brain is actually having more inflammation because of injury. So there would be certain things like cannabidiols from hemp oil or other aspects, again, like that. There's certain extracts that we can give to help it regenerate their neurons. But someone else who's just like, I just need a memory formula, then there's easy certain things like that can help that. There's certain formulas that actually remove tau and beta amyloid and tangle proteins in the animal models. So we're looking at, like, on this dementia early spectrum issue for memory, how can we help with that? But the brain fog is interesting because it's loosely given, and we have to kind of critically define which patient and what is their symptoms of having brain fog, and then address it appropriately.
Is reversing early stage cancer with lifestyle easy or hard or impossible? What about late stage cancer? What can be done to reverse it?
So again, quite a loaded question there, but so the earlier of any disease, cancer included, is always easier to reverse, right? Than in late stage. But what really sets that apart, even on late stage, it depends on, number one, the type of cancer, because certain cancers are just more responsive, believe it or not. Certain cancers are very, very stubborn. Certain tissue types are very stubborn, even from a conventional standpoint. Certain chemotherapies, radiation, surgeries are like, okay, sometimes you can just do a surgery and you're done. You don't even have to do chemo radiation. Sometimes even natural therapies will help reduce that shrinkage. The body is good and takes care of it. So we have that experience all the time with our patients. The problem is when we start compounding comorbid conditions, right? So when we start adding diabetes onto it, when we start adding heart disease onto it, and you start asking autoimmune disease and obesity and all these depression and stress levels, then it's like the body, your immune system is like working on 12 different things all the time, and its ability to focus is then lessened. And so for those patients, when I say follow the steps in my book, you have to do all those steps, because it's not a magic bullet. Everybody wants to say, take this and you're done. Juice this and you're done, or take this drug and you're done. And it's not that, or again, do this yoga, or whatever it is, do saunas. I mean, everybody wants to have some kind of detox or something. It's more complicated than that, but you have to understand the complexity and build a plan around how that person can get better. But it's always through monitoring, right? So the danger that we see in alternative medicine, I'm integrative, so we're not alternative, is that, we still have to do, MRIs and CT scans and PET scans and biopsies and blood work. We can follow the parameters. And sometimes you can do a little bit more, less invasive. And sometimes you have to do more invasive depending on the pathology of the patient and the progression of the disease. And if they're responding, even better. If they're not responding, then we have to add more elements of treatment there. But I don't think it's easy to say, because if anybody says like, oh, you can just easily do this in reverse cancer, then they're not really actually treating cancer patients. They're just selling you programs or selling you some kind of health program or supplement or something like that. I've been doing this 20 years, and I can say that each patient is uniquely different. Even though there's general data in the protocols that we provide that is evidence-based, and every day we're reviewing that data to say which is different. Is there something new in the literature saying a certain metabolic pathway for cancer, for example, of that tissue type? However, it is not as easy to say like, oh, a lot of these cancer clinics in Mexico and stuff like that, they have not shown the data. We've been there. We saw that. They didn't work. To our disappointment, because you always want to say like maybe there's something else that is there on the other grass is green on the other side, but they don't work. And in fact, people spend hundreds of thousands of dollars and don't survive. And that's the shock that most people might hear in this conference. Like, well, I heard that that's just story, that's just myth. A lot of these commercials that I even see on Facebook and all, those people are not alive. Like you all know that because you don't know those people. But so we have to be careful when it comes to treating cancer, because a lot of people, we don't treat cancer. What we treat is lowering the inflammation, looking at the triggers, looking at the epigenetics, looking at what are the factors that makes the body have a difficulty in healing. And if we can appropriately gear that to switch in a positive direction, then the patient has a better improvement outcome. And not only that, it's like even if patients are in, say, a later stage and they come to me and say, hey, I'm stage 3, stage 4, I'm going to have to go through chemo, I have to go to radiation. Can we improve that outcome? Absolutely. Is there certain things that we can give directly that will enhance the benefits and lower the side effects? Yes. Is there certain things that we cannot give during that because it has contraindication? Absolutely. And that's the difference between someone like me and someone who's just a naturopath or a conventional doc. Because conventional docs will say, don't take anything. And the natural docs will say, take everything. And you have to look at how the drug metabolizes, pathways, and you have to understand both worlds. Like, how does this herb work? What's this pharmacology? But then you have to understand pharmacology and metabolism and how the liver works. And these are two different worlds of like classes of alternative practitioners and conventional practitioners. And so when we look at blending that, then we know this drug you can take, it works better, it'll enhance your radiation, it'll lower your chemotherapy and make it more effective. And certain things like you can't take during this treatment because it'll interfere and you'll have more side effects. And so that's how we have to look at bringing this use of natural medicines for cancer patients, is again by an experienced clinician.